What's causing these heart attacks or what's causing the cases of heart attacks across Caribbean countries to rise? Since 2021, a steep rise in heart attacks across the Caribbean. Some people are attributing it to the food that we have been eating, but we've been eating these foods for donkey years, according to people. What's causing it? And that's where you come in. You can leave your comments in the section below, because if I say certain things on this platform, YouTube is going to have their way with us and we won't have a channel anymore. But we're going to get into these articles, which are factual and genuine, and which is happening. Let's start with St. Vincent and then we'll head to Barbados. It's getting pretty nasty. Or maybe I should start in Barbados and then get to St. Vincent. There is a surge in heart attacks that is overwhelming the hospitals in Barbados. That's according to the Barbados Today. It says the Queen Elizabeth Hospital is in the throes of a worsening cardiovascular crisis, which as many as 3 severe heart attacks a day and strokes pushing the healthcare system to its limits. That's according to Dr. Dawn Scantlebury, head of the cardiovascular services, and she warned on Monday about that situation. So we start in Barbados because I've been getting information from across different Caribbean countries, but this is really bad. And St. Vincent has another one. We'll talk about that after. But you're talking about 3 heart attacks, severe heart attacks a day, and strokes pushing the healthcare system to its limits, right? She said the island's top cause of death and disability, heart disease, is outpacing resources and leaving hundreds of patients waiting for urgent care. The thing is, what persons are saying to me in Barbados is that yes, we had heart disease on the top list of problems or deaths for the country, but what has happened in the last 3 years, it has skyrocketed. So something has to be pushing that. She said the island's top cause of death and disability, heart disease, is outpacing resources and leaving hundreds of patients waiting for urgent care. The rise in heart disease, according to the expert, is not unique to the island, as it reflects a global pattern that is placing unprecedented strain on local healthcare systems. Here we go again. It's not unique to the island. Of course, it's not unique to the island, but it reflects a global pattern. And that pattern began according to all of the data I'm reading after 2020. What happened in 2020? What took place in 2021? Why we're seeing so much rise in heart attacks across the globe. And now in the Caribbean, it's pushing our hospitals to the limits. We don't have infinite resources like the US. They can print money on and on and on. Speaking during the hospital's The Pulse radio show on Monday, Dr. Scantlebury revealed that the QEH is now managing significantly more cases of serious heart attacks, segment elevation, myocardial infarctions than in previous decades. What's the real cause of it? What is the real cause of it, doctor? This month, there have been days where we've seen 2 or 3 STEMIs in a single day, she said. 20 years ago, these cases were rare, occurring once a month. That's very good information right there. According to the Barbados National Registry, the island recorded 547 myocardial infractions in 2020 2021, with 150 to 200 classified as STMIs. Additionally, heart failure and stroke admissions have increased further, compounding the strain on the hospital's cardiology services. A record 547 2021, 2020, 2021. Scantlebury revealed that despite the rising burden, QEH operates with the same number of cardiologists, 4 adult specialists, and 1 pediatric cardiologist. That had 20 years ago. So you see the strain right there. She's saying that the mismatch between patient demand and available resources has led to extended waiting times for critical diagnosis, tests, and treatment. Now, do you see what I'm seeing here? We heard that it has outpaced the revenue, the resources to deal with it. We heard about the record breaking amount of heart attacks, right? We heard about the hospital operating with the same set of people, but we have not heard what is really causing the problem. And nobody apparently wants to talk about that. She further encouraged the public to prioritize their health and be mindful of their diet. So basically, she's saying prioritize your health, go exercise, do different things, be mindful of your diet. Basically, Caribbean people have been eating the same set of things for the last 2 decades, if you don't mind. But nothing in the story gives you an idea as to what is actually causing the issue. Everybody's running away from it. Guys, leave your comments in the section below. Start the discussion and start it like you're mad down there in the comment section. If you think that is bad, now let's head over to neighboring St. Vincent and the Grenadines because people have been questioning since 2021 why are so many people dying of heart attacks. Over 500 deaths in SVG due to heart attacks since 2021. It has become the leading cause of death again. Ischemic heart disease, or commonly referred to as heart attack, is the main cause of mortality in the Caribbean nation of St. Vincent and the Grenadines. So, like Barbados, St. Vincent is the same. Since the year 2021, more than 500 persons have passed away as a result of heart attacks, as stated by the Minister of Health, Sinclair Prince. Major cause of death in 2021 was ischemic heart disease, which accounted for 171 deaths. In 2022, the leading cause of death again was heart attack, which accounted for 134 deaths. Again, 159 deaths in 2023. And as of 30th September in 2024, it was responsible for 117 deaths, bringing the total number of deaths to 581, according to the Health Minister Prince. There goes the issue. And of course, the article continues to talk about what is heart disease and such and such and such is the case. But you know what's funny? In all of the articles, whether Barbados or St. Vincent, none of the people in the health sector wants to tell you what is causing the issue. That is something I would say is detrimental to our people when authorities don't want to tell you what is causing the problem. They're telling you the numbers, they're saying it is the leading cause of death, but yet nobody wants to address the elephant in the room. What is causing the escalation in heart attacks? Nobody wants to say it. I have a good idea as to what, because I know friends who died after taking certain things during 2021, 22, 23. But if I say it here, according to YouTube, I and this channel could be thrown off, give warnings, and even deleted because still YouTube is still trying to suppress our voices. I want you guys to comment in the section below as to what you think. Comment, because if you don't comment, other persons in the community are not going to see this video and it won't be recommended, and it needs to be recommended in YouTube recommendations. And up next, guys, share, like, and subscribe. Please comment in the section below and continue to follow this channel, subscribe to it, hit the notification bell and notify all so you know when we post new content. Have a good day, guys. Looking forward for your comments in the section below.